to share a case that really captures how neuro-informed functional nutrition can change someone's trajectory so you can get an idea of how my approach works. So, the client I'm going to share was a 38-year-old man who came in with long-standing depression, fatigue, anxiety, and significant gut issues. He described his depression as treatment resistant and felt stuck in a body that wasn't responding no matter what he tried. He was actually in an existential crisis. So when we looked deeper, several things stood out from his case. First, we did some labs. We did gut labs, we did organic acid labs, and we also did a mycotoxin lab. So his gut lab showed that he had an H. pylori infection, he had low gut immune markers, and he had an imbalance in his microbiome that was leading him to dysbiosis, or as some people understand it, is leaky gut. He was also undernourished despite eating late at night, relying heavily on alcohol and cigarettes, and taking a very high dose of gabapentin that was contributing to weight changes and fatigue. So he was not setting himself up for success with his lifestyle and his eating habits. From a nervous system perspective, his immune system was underfueled, his entire system was underfueled, he was inflamed, and he was stuck in survival mode. So our approach wasn't about doing everything at once. It was about restoring safety and stability for his nervous system first and addressing his gut and healing it. So we focused on front-loading nutrition earlier in the day with getting enough protein and carbohydrates to support brain, energy, blood sugar, and his mood. We supported the gut barrier and the immune function. We increased bile flow, which helped with digestion, and we focused on mineral balance to make sure his body was actually absorbing what he was eating and replenishing what he needed. At the same time, we addressed the nervous system directly. I introduced a daily red light helmet protocol that is designed to support mood regulation. It helped with ruminating thoughts, and it helped with his depression and anxiety, a relief he had never felt before. So these lifestyle shifts were also essential for this, not a place of shame, but support. So we worked towards reducing alcohol and smoking to lower the toxic burden and give his gut and brain a chance to really recover. So what happened next? Within 1 week of using the red light helmet protocol, he reported a dramatic improvement in mood and energy. His depression score was at a 5, which is the highest it ever was, and it came down to a 1. His anxiety had never fully decreased before, and that also came down to almost a 1. He had also noted that he had anger and irritability, and that resolved completely. His sleep became deeper and more restorative, he ruminated less, and for the first time in years, he felt mentally clear. And that was within 1 week to 4 weeks of using that helmet. But also, as his gut health improved, foods that once caused discomfort from that leaky gut became tolerable again. He got to enjoy onions. He got to have avocados again. He was loving his life with that. He started enjoying cooking with his partner. He felt more connected to food, and he no longer experienced nightly crashes that he had had for years and relied on having to overeat at night. So over 4 months, he fully stopped drinking and smoking. He completely dropped his medical questionnaire symptoms from 96 to 42, which is a huge decrease in 4 months. And he felt so much better than he had ever felt before with trying medications because that helmet just gave his brain that relief. So the most meaningful change, he actually told me he could finally imagine a future again, which is not common for people who are struggling with severe depression. So he's exploring a PhD program and connecting with goals that he had long given up on and hadn't even considered anymore. And this is why I do the work that I do. When we support the gut, the brain, and the nervous system together and nourish the body instead of fighting it, people don't just feel better, they actually get their lives back.